CPR in 2026. What's changed and how you can save a life. You're at home, enjoying a quiet afternoon with a loved one. Suddenly, without warning, they collapse. They aren't breathing. In that moment, your heart pounds and a feeling of sheer panic washes over you. What do you do? For many of us, this is our deepest fear. But what if I told you that in the next few minutes, you can learn the simple, updated method that has the power to save their life? The official guidelines have changed, bringing back a classic technique alongside chest compressions to be even more effective. You have the power to be a hero in that terrifying moment. Stay with me and let's show you how. The critical difference: heart attack versus sudden cardiac arrest. Before we get to the how, we need to clear something up: the difference between a heart attack and a sudden cardiac arrest. People often use the terms interchangeably, but they are not the same thing. Think of a heart attack as a plumbing problem. It's a circulation issue. A blocked artery stops blood from getting to a part of the heart. The person is usually awake and can tell you something is wrong: chest pain, shortness of breath, or pain in their arm or jaw. During a heart attack, the heart is still beating, but it's being damaged. Now, think of sudden cardiac arrest as an electrical problem. The heart's internal electrical system suddenly malfunctions, causing it to stop beating altogether. The person will collapse, lose consciousness instantly, and stop breathing normally. There will be no pulse. This is a true life or death emergency where every single second counts. Brain death can begin in just a few minutes, which is why your immediate actions are so critical. Here's the link. A heart attack can sometimes lead to a cardiac arrest, but they are different events. When you see someone suddenly collapse, you are most likely dealing with a cardiac arrest. The pump has stopped. And this is where you come in. The why behind the 2026 CPR update. For the last several years, the big push in bystander CPR was hands-only. The idea was to simplify things and remove the hesitation some people felt about giving mouth-to-mouth rescue breaths. So a big question you might have is, why the change? The answer is that the science has evolved. The American Heart Association's 2026 guidelines now recommend that lay rescuers who are willing and able should perform CPR with both chest compressions and breaths. While hands-only CPR is still an effective and life-saving option if you are unwilling or unable to provide breaths, studies have shown that combining compressions with breaths can improve outcomes. When an adult goes into cardiac arrest, their blood has a limited supply of oxygen. Chest compressions do the crucial job of circulating that oxygenated blood to the brain, but eventually that oxygen runs out. Rescue breaths replenish it. Think of it this way: the compressions are the engine, but the breaths are the fuel. The new guidelines are about giving the victim the best of both worlds, keeping the engine running and refueling the tank. The simple step-by-step plan to save a life. You've witnessed a collapse, your adrenaline is surging, but you can do this. Forget complicated movie scenes and focus on these simple, powerful steps. Step 1. Check and call. First, make sure the scene is safe for you. Then, check if the person is responsive. Kneel beside them, tap their shoulder firmly, and shout, "Are you okay? Are you okay?" If they don't respond and are not breathing or are only gasping for air, which can look like snoring or strange snorts, you need to act immediately. Your first action is to get help on the way. If you're alone, call 911 on your cell phone and put it on speaker. If someone else is with you, point directly at them and say, "You, call 911 and get an AED if you can." Delegating is key in a crisis. The 911 dispatcher is your partner. They will stay on the line and can even count out the compression rhythm with you until help arrives. Step 2. Start chest compressions. As soon as the call is made, don't wait. Start chest compressions right away. Get the person on their back on a firm, flat surface. Kneel beside their chest. Place the heel of one of your hands on the center of their chest, between the nipples. Place your other hand on top and interlace your fingers. Now, for the key to power, lock your elbows straight and position your shoulders directly over your hands. You're not using arm strength, you're using your upper body weight to push down. Push hard and push fast. You're aiming for a rate of 100 to 120 compressions per minute. An easy way to find this tempo is the beat of the song "Stayin' Alive." Push down at least 2 inches. This depth is vital to actually squeeze the heart. After each push, let the chest come all the way back up to its normal position. This allows the heart to refill with blood before the next pump. Step 3. Add breaths if you are willing and able. After 30 compressions, the new guidelines recommend giving 2 breaths. Gently tilt the head back and lift the chin to open the airway. Pinch the person's nose shut, make a complete seal over their mouth with yours, and give one steady breath for about 1 second, just enough to see the chest rise. Let the chest fall, then give a second breath. But, and this is the most important part, if you are not trained, willing, or able to give breaths for any reason at all, do not stop. Just keep giving chest compressions continuously until help arrives. Continuous compressions are infinitely better than doing nothing. Continue the cycle of 30 compressions and 2 breaths, or compressions only, until professional help takes over, the person shows obvious signs of life, or an AED is ready to use. Addressing your fears. It is completely normal to feel scared. Let's tackle the biggest fears head-on. First, what if I'm not strong enough? CPR is designed to use your body weight, not just muscle. By locking your arms and rocking from your hips, you can deliver powerful compressions. Remember, any attempt at CPR is better than no attempt. Doing something, even if you feel it's imperfect, gives your loved one a chance. Doing nothing guarantees the worst. Second, what if I hurt them? What if I break a rib? This can happen, but in a life or death situation, a broken rib can heal. A brain without oxygen cannot. You are not hurting them, you are fighting for their life. If an AED becomes available, use it immediately. These devices are made for untrained people. Just open it, turn it on, and a clear voice will tell you exactly what to do. An AED is the most effective way to reset the heart's electrical rhythm. The power to save a life is within your reach. It's about acting fast. First, call 911. Second, push hard and fast in the center of the chest. And third, if you can, add 2 breaths for every 30 compressions. You are the vital link in the chain of survival. Your actions can give someone the best possible chance of coming home. You are not helpless. You are powerful. For more official information and to find training courses near you, please visit the websites of the American Heart Association or the American Red Cross. And finally, please share this. Share it with your friends, your family, and especially the people you live with. The knowledge of how to act in an emergency could empower someone to save a life. It could even be yours. Thank you for watching.